The Trump administration is trying to contain the fallout from yesterday's COVID-19 briefing, where the president shared some controversial theories about treating the disease. So to help us better understand what is dangerous and what is not, what is truth and what is not, we want to bring in Dr. Bob Lahita. Thank you so much for joining us, Dr. Bob. So there's sort of a list of things that the president floated and then sort of looked to his experts to kind of co-sign on it as he was talking. So I'm going to start with the first one that he brought up was the impact that heat and sunlight has on the virus. And then he went on to talk about the ability to have UV rays enter the body and I presume somehow damage the virus. So can you explain the nugget of science that is in that statement? Essentially, what is true and what is not true about that statement?
Okay, so let me explain that we've known for decades that UV light is very effective in killing bacteria and viruses if it's applied to surfaces like cardboard or wood or steel. And certainly sunlight for your boxes in front of your house on your porch that are being delivered, that's excellent. And high humidity. But remember, ultraviolet light in general is dangerous to people's skin and is a source of skin cancer. And many of my patients who have connective tissue disease are very sensitive to ultraviolet light. So it is dangerous when used excessively. So in the environment, yeah, I guess sunlight will kill the virus. High humidity will kill the virus. But again, its use on humans is not recommended. You don't sit under an ultraviolet lamp unless you're one of these people that goes to a tanning salon for 5 minutes and tries to get a tan. Ultraviolet light is not healthy, particularly UVB, B for bad. UVB light is not healthy for the skin.
Okay, doctor. So let's just explain to our viewers what happened yesterday, this surreal moment when the President of the United States was at that podium informing the American people, or at least giving the impression of informing the American people what actually happened. Scientist William Bryan, who is the head of science of the Department of Homeland Security, told the briefing that the government had tested how sunlight and disinfectants can kill the coronavirus on surfaces in as little as 30 seconds. So that was what he told folks who were in that briefing room. The President of the United States then raced back up to the podium and excitedly started to ask about the use of disinfectants. And he said this, and I'm quoting here, "And then I see the disinfectant where it knocks it out in a minute, 1 minute. Is there a way we can do something like that by injection inside or almost a cleaning?" You do not recommend, no doctor on earth, no scientist on earth, no person on earth would ever recommend what the president suggested there at that lecture.
Yes, God forbid you should breathe in Lysol in great amounts or inject it into yourself or bleach. People try to commit suicide by injecting bleach or by drinking bleach. This is not a thing that anyone should do. It's a very deadly thing. It was a mistake to say that in the public forum. There is a very effective way to get things off of surfaces, to wipe down your briefcase or your car steering wheel with bleach or with Lysol, or to use it in the gym to wipe your equipment, but never, ever take it internally. I would not even rub it on my skin because it has that degree of toxicity. So people have to understand that they cannot use bleach on their skin, Lysol on their skin, or God forbid, inject it or drink it.
So, Doctor, just to clarify, because sometimes the president is rather imprecise. He said two other things, and I just want to get it clear. He talked about UV rays going into the body. You said that UV rays are that they're damaging to the skin. Do you know of any treatment in which UV rays go into the body? And then the second thing he said in regards to disinfectant, I just want to clarify. Do you know of any disinfectant-like treatment that is injected into the body?
No, there is no disinfectant-like treatment that is injected into the body. Categorically, absolutely, positively, no. And as far as UV light goes, there are no treatments except perhaps for psoriasis done under the guidance of a dermatologist. And we used to have an old process where we took human blood and we irradiated it. We took the human blood out of the body, irradiated it in a chamber, and gave it back. But that's since been outdated, and we don't use that anymore. So no to all of your queries.
Let's point out, Doctor, I don't know if you're aware of this, but the maker of Lysol and Dettol brands, RB, issued a statement on Friday saying this: due to recent speculation and social media activity, RB has been asked whether internal administration of disinfectants may be appropriate for investigation or use as a treatment for coronavirus. As a global leader in health and hygiene products, we must be clear that under no circumstance should our disinfectant products be administered into the human body through injection, ingestion, or any other route. So we're doing that because we want people to understand that you should not do that. And even the makers of those products, just in case somebody who is looking for information and looking for that information from the President of the United States would perhaps hear that or even misinterpret what the President said, this is the maker of those products coming out with that statement. And Doctor, this is on the back of President Trump promoting over the course of several weeks hydroxychloroquine as a possible treatment. But some people who take the medication for autoimmune diseases like lupus or rheumatoid arthritis are being denied prescription refills. And we've even seen recently this week that after a small study, albeit a very small study that was done, showed that it didn't affect patients who, in the way that the president had suggested it would, by taking those medications to combat COVID-19. What are you telling your patients who find themselves in this situation?
Well, first of all, I have many, many patients that are on Plaquenil or hydroxychloroquine, that's the other name for it, and they cannot get it. The pharmacies are out of it, and they require it for their diseases like lupus, in some cases rheumatoid arthritis, and a condition called antiphospholipid syndrome where the blood clots prematurely. So they cannot get this drug now. Our experience with hydroxychloroquine in our patients in the hospital for COVID-19 has been very negative. We have not seen a dramatic effect from this drug. So frankly, we think it's not an effective drug at all. So to answer both your questions, the drug is not very effective. There's been no clinical trials to prove that it has a major effect. And secondly, my patients who need it can't get it.
Dr. Lahita, thank you so much. We need science and a clear medical understanding in these times, and you have given that to us. We really appreciate the time that you spent with us.
Thank you very much for having me.
Thank you, Doctor.